Hi, my name is Samantha Gonzalez, and I'm a senior at Walter G. Colpic High School. My question has some backing around it. So I read a story that you've written with the LA Times with your own experience on the vaccines, in which you questioned the validity of the vaccine. My question to you is, how do you predict this ideology might shift under a new presidency? And also, how do you think this mistrust in vaccines and healthcare could ever be repaired in the future?
So thank you so much for that question, Samantha. That's a great question. So because of my work as an emergency medicine physician on the front lines, I was amongst the first to be offered to take the COVID vaccine. And when I found out that I would be able to take it, my initial response was, no way, I'm not taking this vaccine. And I almost surprised myself with the fierceness with which I said no. And so I had to really step back and say, well, why did I have that reaction? Why don't I want to take this vaccine? And some of the reasons did have to do with mistrust. And despite the fact that I'm a physician and I work in healthcare, maybe because I'm a physician and I work in healthcare, I know I have experienced myself, I have seen my family experience, and I just see what my patients and our patients go through with regard to experiences of racism within healthcare. Racism that happens, sort of individual racism, but also institutional and structural racism, and how that pattern sort of opportunity and leads to issues of medical mistrust. And then some of the other reasons around that had to do with the speed of the vaccine. So the speed of the vaccine development, being a little bit skeptical, quite honestly, about how things that normally take so long in science to develop, how something could be developed so quickly. The mRNA technology behind two of the Pfizer and the Moderna vaccine, I had never heard of that before. And so that was new to me. And so I had to do my own research to understand that this actually wasn't a new technology. It's something that's been around for a long time. But this was sort of the perfect confluence of events to use this for this type of vaccine. And then finally, sort of getting to your question about ideology shift, my personal view of the prior president made me skeptical. I felt like he was using the vaccine as a political tool, sort of promising, oh, this is going to be available by election day. Science doesn't work that way. You can't determine the date in advance of when something's going to be eligible. So that certainly played a role in my own decision making. What I had to do, and then what I have tried to do for others, is to go through a learning process. I had to read information. I had to talk to experts to talk about my concerns and my own fears and get my questions answered. Because while I'm a physician and a researcher, I'm not a vaccine scientist. And so there are things that I had to learn around that. In that process, and along with the fact that my mom begged me to get the vaccine, that also played a role. I ultimately decided that I would get the vaccine, and I signed up to get it. I got it on the second day that it was available. And I am so thankful that I was able to do that. What I then started doing was talking to my colleagues first at work, and particularly to my Black colleagues, who are mostly either environmental services, registration, tax, unit clerks, and just asking them hey, are you thinking about getting the vaccine? Because we were all eligible, because we all work in the emergency department. And so I found that me sharing my own hesitancies and my own journey from no to yes, and being able to sort of be a trusted voice for my colleagues and to allow them to have their questions answered. Many of them actually, because of conversations with me, decided to get the vaccine. And so I realized that, when we're thinking about reaching people, whether it's Black individuals or people right now who seem to be least likely to want to get the vaccine are actually white evangelicals. So people from the trusted community, whoever you're trying to reach, those are the people that you want to talk to people, share stories, answer questions. My hope is that, to get directly to your question, with our current president, that there's a different tone, there's a different conversation that is able to happen in our country right now that is more open to asking and answering questions, to making sure we're reaching all people across the country who in whatever ways that we need to do. And so I think that some of the mistrust that was built up in the prior 4 years will be repaired moving forward. I think the final thing I'll say about mistrust, and particularly mistrust when we're thinking about mistrust in Black communities, is that there have been centuries of harm that has happened to many Black communities in this country, and those legacies, the legacies of structural racism that have been baked into policies and procedures in this country, it's really all of that leads to medical mistrust, any mistrust, but medical mistrust in particular. There was a study, for example, that showed that individuals who have negative interactions with the police actually have higher levels of medical mistrust. Because for individuals, many people don't think of like, there's the criminal justice system, there's education system, there's healthcare system. It's just your life. And so when you experience harm at the hands of some body of power, you come to expect that harm from all bodies of power. And so we do have a lot of work to do in this country to repair and heal from the harms that are ongoing from different sort of systems and structures.